All right, so I have just entered the patient's room. This is patient number 2. And I've introduced myself. Hello, I'm Nurse Nathan. I'm going to be taking care of you today. We have some doctor's orders here to provide you with some tracheostomy care. Before we go ahead and get started, can you tell me your 2 identifiers? All right, patient states who they are, and they're correct. They are who they say they are, and this is verified with the computer. We're looking really good here. So we do have a doctor's order to provide this care for you today. Do you have any questions about what's entailed with tracheostomy care? All right, patient states they do not have any questions. So I'm going to go ahead and I'm going to close the curtain to provide some privacy. I'm also going to raise the bed up to a comfortable working level. I want to make sure that I sit the patient up to a high Fowler or Fowler position. And I'm going to check their oxygen saturation levels and make sure that they're optimal for doing this trach care at the moment. And I'm also going to put on a pulse oximeter for the duration of everything that we're doing today. So again, do you have any questions before we get started? Patient still does not have any questions before we get started. So at this point in time, I'm going to go ahead and sanitize my hands. And don some clean gloves. And we will remove the old tracheostomy bandage here, and we're going to just toss that. Now these gloves are dirty. We can go ahead and just get rid of these now. And I will sanitize my hands once again before opening up my sterile tracheostomy kit. Now I want to make sure that I'm opening this away from my body, away from me at all times. I'm actually going to move this over a little here to make room for my sterile field. Now only touching the shiny side of this sterile field. I'll do my best to open this here. And we'll get our sterile field down. Once we have our sterile field down, we can go ahead and dump the contents. Of our tracheostomy kit. We need to save this because we're going to actually use that. To our sterile container, make sure it's in view of the camera here, but I can't. Well, I mean, this should still be in the view of the camera. We're going to have our soaking solution as well as our sterile solution, our sterile water here. And we need to start some things soaking here. So I think the first thing I want to do out of this is I want to get my sterile gloves on so I don't have to worry about contaminating anything in my sterile field. So I'll just grab the bottom of the cuff on this sterile glove and thread it onto my hand. And with my sterile hand, I can manipulate this one a little just to get it ready for me. But I'll have to go under the cuff on this one. And we'll apply it like so. Alright, we are now sterile. So everything's set up for us. I need to get some things soaking here. I'm going to add my cleaning applicators as well as my brush in here. Going to get it ready for doing everything we have to do for this tracheostomy here. Okay, so first thing I want to do is I want to unlock this inner trach cannula here. And I'm going to get that soaking. Now, once that's soaking, I want to go ahead and use my brush, and I want to clean it. Clean it very well. And then I'll put it in my clean solution over here once I've done. And then before I go any further, I want to state that this is a 2-person procedure, and for purposes of when I'm taking off this necktie, I would have someone holding this for me. But in my case, I'm alone, so I'm going to do my best to keep it on there, but I would have a second person during this. Alright, so I'm going to replace my inner cannula for the trach here. Once it's dry, I'm not going to put it in wet, and I will get it back in, and I will lock it in place. At this point in time, I would like to use my applicators here to clean around the stoma, and I would clean all around the support portion here. Generally, we're just cleaning anything that we can see around this entire tracheostomy site, and everything looks good and it's clean now. We can now remove the trach tie. And we have a new trach tie here. And we'll pull it through, down and around. That is not long enough. Okay, so we have our new trach tie on there, and I want to make sure that I'm going to be providing some cushioning over the knot here. So I want to make sure that we're promoting skin integrity for our patient. Alright, so we promoted our skin integrity. And last but not least, I want to make sure that I get a brand new tracheostomy cover on here. Alright, and we can now just make sure that the patient's vitals are still doing well, which they are. And you can ask the patient if they're doing okay. They said that they're doing great, so no issues. And I think that should conclude the tracheostomy care for the patient. And I will make sure that I clean up my entire mess. And discard all the trash. Alright, thank you.